Addiction is a family disease. We hear about the problems that addiction brings to the addicts, but what about the families? What are their stories? What help is available for them? Coming up next on Toronto Speaks Addiction. Hi, I'm Dr. Vera Tarman, and welcome to Toronto Speaks Addiction. Tonight we're discussing addiction as a family disease. What's it like to have a family member struggling with addiction? How do you cope? What kind of help do you need? Joining me tonight are two addiction counselors, Hamish White, Director of Toronto's Recovery Counseling Services, and Donna Alexander, a family counselor who works with Hamish. They have seen the devastation that addiction can bring to families. We are here to answer your questions about the problems you may confront when trying to help a loved one get clean and sober. We have coping strategies and resources that may help you. So whether you're the one struggling with the addict or worried about someone who is, please give us a call. So the first question I'd like to ask one of you, Hamish, why don't we start with you? What does it mean when you say addiction is a family disease?
Well, Vera, thank you for asking that question. It's confusing because often family members will say things like, well, it's his problem or her problem. Why doesn't he just do what he's supposed to do? And there he goes again. He's just weak. And what ends up happening is the family, regardless of the position the alcoholic is in the family, ends up modifying their behaviors around them. And so problems, it can affect people's psychological health. It can affect their financial health. It can, if the alcoholic gets fired, I mean, it just changes the whole family dynamic, and then bit by bit, time by, sort of week by week, I suppose, the family ends up coping with the what shouldn't be coped with, and gradually things change, and everybody becomes, if you like, sick.
And I guess you would know because your agency, and Donna, you work with Hamish, works specifically with families, or first of all, why don't you give us a little bit of a background about what your work is?
I'm going to let you answer that.
Oh, thank you, Donna. Well, you're talking about our agency then?
Yeah, do you do specifically family work, or is it...
Well, we do believe that addiction is a family disease, and we do find out that we found out over time that we're just trying to deal with the person who's the alcoholic or designated addict. Just by dealing with them without dealing with any of their family members, the chances of success seem to go down. A person, we can help somebody get sober, perhaps they go to a treatment center, perhaps they go to Alcoholics Anonymous, whatever it is, they're doing very well.
Yeah.
And, the wife at home might say something like, when he was drinking, I never really saw him because he was out with the buddies, and now that he's home from treatment, he's out at his AA meetings, what about me?
And so that what about me, that's kind of inspired both of you to think that maybe you should do something for the other person.
I think that's been our model all along, is to involve families in the process. Families very often have similar symptoms to the addict. They isolate themselves in denial, minimizing, burned out, angry. It very much parallels some of the things that the addict experiences.
Yeah, I remember when we were talking earlier on that you were talking about how the family also has symptoms that are just like the addict.
Yes.
So that's what you mean by that.
Exactly.
Yeah.
Exactly. And also family members struggle with what help is, and they are motivated out of love and concern to help their loved one, but very often it's not in a way that is going to be healthy for them and ultimately for the addict.
Is it helpful to call it a disease? Like you say, addiction is a family disease. Like how can you, is that just a metaphor that you're using, or is it because of the parallel?
Well, I think it is a disease. I think it's a brain disease. There's a lot of science to support that
Even
now.
with the family?
With the family, again, it's very similar symptoms, and very similar outcomes in terms of the families deteriorating, not being able to
Right.
function.
Yes, it's
so it
almost
may
like-
not be physiologically
Yeah.
the same disease, but certainly
It's like envisioning the family as an organism that is falling apart in the same way as the
Exactly,
addict. It's an
exactly.
interesting way to see it. Yeah, and that would be how you treat the family in the same way then.
Well, I think in terms of what family members want to know what to do. They're terrified. And so, for example, if we're working with a young person, let's take that as an example. The young person says, "You don't know anything about drugs." Well, that's true.
Yeah,
The parents
that's true.
often don't, and if they, they go, "Well, that's true," and so by coming, so part of what our philosophy is to help parents or help family members learn what to do and not to do. And I think the biggest thing that's important is that you are not alone, is to let people know
Yes.
that often they'll come to us and I think they're the only person on the block,
Exactly.
that, that somehow
Right, which is
addiction
the
or
isolation.
alcoholism is only for, for I don't know, so disenfranchised people or people with financial problems, and it's really right across the board. So by being able to be sort of normalized that this experience, so Vera, if somebody had diabetes, it's very easy. You go in and you say, I have these symptoms. If I eat this is what happens, or I get dizzy, and so the doctor does blood tests, and decides, yes, you have blood sugar disorder, and we're going to give you insulin or a diet or whatever, and everybody knows what to do. Bang, 1, 2, 3, and that includes diet, and certainly the family needs to modify. And so, in order to make sure, well, let's have some chocolate cake tonight. Well, no, we can't do that because we're trying to eat
Right.
properly and treat the diabetes. And I think that that information sometimes is not as clear to the alcoholic's family who is suffering. However, I think that in this day and age, it's really quite. Since I became involved in the addiction recovery, things have really changed. I mean, there's a lot of support out there now.
So if there's anybody who's watching, who's a family member who may feel that they're alone or they want to, ask a question, please give us a call. So we're here to take questions, to give advice, to listen to your story. If you've got a message of strength and hope, please do that too. So I invite you all to call in. Let me ask you a question that I'm sure a lot of family members are worried about is, am I contributing to the problem? Am I making my kid go out there?
I think that there's a lot of guilt and shame that families carry, and it's not so much, nobody's making their child or loved one go out and use. There are ways that families can support recovery, and there are ways that they support addictive behavior.
Can you elaborate on that?
I think motivated out of love, they feel badly, their kid doesn't have any money or, to do the things maybe that their friends are doing, so they give them money and they go out and use. And I'm talking about kids because I work primarily with parents, although I also work with spouses. And that can
And that's what's
assist
called
the addiction.
enabling, right?
That's what enabling
Yes.
is. And they also ride the emotional roller coaster. When their child's doing well, they're doing well. When their child's doing poorly, they're doing poorly. And that's what we would term codependence.
Right. Now, I would imagine that there's a real balance between enabling and just loving your kid or your spouse. Like, what's the difference?
The difference really is that when you enable, you're doing something for someone that they should and could do for themselves. And that's one of the definitions of enabling. It's also supporting behaviors, inadvertently supporting behaviors that are unhealthy and destructive.
Right, that's really interesting. So so if the person can do it themselves, you should let them do it themselves.
And that might mean that they're, going to hit a bump doing that. And I think we all have the philosophy that somebody does not have to hit rock bottom, but there's ways of making the bottom meet the individual.
Yes.
And sometimes that's doing less and not more.
Yes, that's right. If there's anybody listening who has the question of how I am with my child, am I enabling or am I loving the person, give us a call. We'll be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. I'm Dr. Vera Tarman, and joining me today are Hamish White and Donna Alexander. Today, we're discussing the family of the addict and how to help those behind the scenes. So before break, we were talking about this sort of fragile balance between enabling and loving. And so what is it that gets people so enmeshed in this addictive behavior so that they can't see what might be really obvious to somebody else? Hamish, do you want to take that?
Sure. Well, first of all, people use drugs or alcohol for their own good reasons, and it's different for everybody. So, why is it that some people are able to have a drink or two and let it go, and other people seem to have a drink or two and they want 20 more? Why is it that it only seems to be about 15% of the population seems to have a problem, and why is that? And certainly it depends on really what happens to the person's brain when the alcohol and the drugs go into it. And so if the person has a drink or takes a drug and the reaction is, I don't like this very much, it makes me kind of dizzy, I don't want it anymore, they're probably never going to come and see us or you or have to go to an AA meeting. If the reaction is, well, this is kind of fun, but I like my life as well, then maybe they'll be social drinkers, or maybe just try a little bit of stuff out, but their life's going to be all right for the most part.
Yes.
And then if the effect is, wow, I found the answer, this is the best thing ever.
It made me feel normal. That's what I hear people say.
There you go.
Yeah.
Normal and wow. And why is that? How come people get that feeling? What is it about the brain? And I think it can be for a variety of reasons. It could be the person is depressed and suddenly they're not. Wow. Or it could be, I have ADHD and I've got 1,000 thoughts a minute and I take a drug and I only have 3 thoughts. What pleasure. Wow. Or I don't really feel good about myself. I'm not very handsome. I'm not very pretty. I take the drug and I am handsome and pretty. So wow. And of course the brain goes, this is what we want. Let's do it again. So the person gets invested in using the drugs as time goes on, and they're using for good reasons. Vera, they're using to feel better. They're using to be handsome. They're using to become more loquacious. And so when someone like a family member says, you know what, there's a problem here. We need to stop this. It's go, what is wrong with you? I've found the answer and you haven't. So they become extremely persuasive and try to explain.
So Hamish, we have a caller, so let's grab the caller.
Let's grab the caller.
Cheryl, you're on the line. Why don't you ask us a question?
Hi. I was wondering if there are any stats or just generalized knowledge about the success rate of the addict, whether the family is in treatment themselves or not. In my own family, I have one member who has been sober for many, many years, but without having had treatment, so is still full of what I would call isms. But the other person in my life who is in recovery is in a recovery program, and there's a huge difference. And I'm wondering what difference it makes whether the rest of the family is in recovery or in treatment for help.
I would imagine that you, thank you, Cheryl, very much for your question. I would imagine that you probably have experienced the difference between a family member and the person's recovery.
Definitely. I think when families are involved, they are also going through their own healing and own recovery process, almost parallel to the person who's in treatment. They're learning not only about addiction so that they understand what their loved one is going through, but they're also learning about their own coping strategies, what has worked for them, what hasn't, how to maintain boundaries. It's the addict, it's important that they come back to a healthy environment because the whole family has been unhealthy through this process. So I think that when families are involved, they're enabling recovery versus enabling addiction.
Right, it's that concept of enabling again. When you talked about that, that reminded me of the article, Hamish, from a couple of years ago when you were quoted, the whole Rob Ford issue, and you were quoted, and I think you said something about how the family is involved in a crazy dance. Did you want to pick up on that? Because I think it illustrates this.
Sure. The metaphor I use, and some of my clients like it and some don't. I'll say that right away. And to answer Cheryl's question, I really do. The fact is, there is a dance that needs to be learned. And what ends up happening when someone is using drugs or alcohol in the family, that the music that is played in the family gets louder and louder and louder as the disease or the addiction progresses, and the family becomes extremely good at dancing to that crazy music. And even when the person's in recovery and they're sober, they're more comfortable dealing or dancing to that crazy music than dancing to the new music of recovery. So I like to say that recovery for the whole family is like going to Arthur Miller's, and it's like it would be like a family member saying, I'm going to go to Arthur Miller's and I'm going to take dance lessons and I'm going to learn how to be the best dancer, but sweetheart, you're going to stay at home. And then when I'm all better with my dancing, we're going to go to Arthur Miller's and we're going to have a great time. Now what's going to happen? I mean, she's going to be stumbling and so what, and falling and feel embarrassed. She's not going to want to go out. In fact, she'd probably prefer the person we're going back to the old dance because it's more comfortable. So really, while the person is away in treatment or getting better or going sober or going to AA or whatever it is they're doing for their recovery, it's important to have the family member learn those new tunes. And the new tunes are quieter, healthier, if you like, but they're steps that need to be learned. And the old ones are more comfortable and therefore very easy to get back into because they know the steps. So our goal is to get people on the same page, learn the same dance, and listening to the same music.
So that would make sense. That would make a lot of sense then, that there'd be more success if both people know how to dance to the same music.
That's it.
But now, what about this is something that I see often, and I really cringe when I hear a person they come to treatment, they're doing really well, but they're going back to a partner that's still using, or even a family that's still using. And what would you do then? Because in a way, the tables turn. Now the addict is the family member with the people who are. What do you do there? Do you tell them to leave, or?
That's an interesting question.
It gets
Would you like me to
really
speak to it, or?
well.
Sure. Well, it's. I guess it depends on what extent the family is using and drinking. Certainly, I would tell a person to not go back to to stay away from people who are drinking and using, and if that means staying away from their family, if it's going to bring them back to drinking, then they should probably find a way to stay away. It's often not very practical. Donna, one of the things parents often ask us that with when there's a young person involved, don't they?
They talk about whether or not to lock up the booze or things like that, and it really isn't lock up the booze because Johnny's coming home. It's, can you support your loved one by keeping a sober home if they're using drugs in a recreational way, which we can debate another time.
Sure.
Is that something that you must do around your loved one, because that's not going to support their sobriety. And sometimes we do recommend for young people that they go to sober living home, or they're
even
going
though
to
they may have a
university.
home to go to.
Because I think that again, they need time to heal, and their families need time to get the steps right as well before the family is
That's yet another
integrated.
example of how learning the steps on both sides, they'll allow the person to go to sober living. So Cheryl, does that answer your question?
Yeah, and it kind of it underlined my own experience in that I've been going to Al-Anon for 21 years, and in Al-Anon I learned exactly that, to seek my own serenity essentially, and to let my husband work his own program so that we have kind of a similar language, but that we respect each other's recovery, because I needed to recover just as much as he did. It's kind of like, it's the same isms without that little bugaboo of the addiction, but the same emotional geography.
Well, Cheryl, I really want to thank you for your question. And callers, please take the lead and give us a call if you're having a similar experience, or you want to give an experience of strength and hope. Now, Cheryl mentioned a couple of times the isms, and one of the things that I've heard people saying, what happens over the family over the course of time. They can become overbearing, they can become over-controlling. Like I would imagine that it's not just that the family system becomes ill, but the person's own psychology do you deal with that? Like, do you have individual people who are, like, it's just about them now, not about their partner or their child anymore?
We definitely support spouses and parents around those very issues, really helping them understand what is in their control and what's not in their control, and also to respect their loved one's recovery process as their process.
Which is back to that enabling issue.
Yes.
Yeah.
And at our outfit, we have a team of people that can supply psychological support. We have a psychologist on the team, and Donna's a social worker. We have addiction counselors. We have counselors for the youth, counselors for the other, and often some families will take advantage of our support groups, the family support groups, psychological service, couples counseling, because all these things often need to be addressed when somebody gets sober, because the time has been spent in the past putting out fires or going from crisis to crisis, and so it's like the new music is playing, and you need all the instructors you can get sometimes to get back on track.
Yeah. Are there particular families who tend to come and seek help and others who don't, that you wish would?
Interesting question. I think that, well, I wouldn't know if they wouldn't come to seek help because I wouldn't see them.
Yeah.
I think that some families may recognize a problem sooner than others and choose to do something about it, perhaps because there was a family member themselves who got sober in their history, so they know about recovery, they know about that doesn't have to be that way, or they've seen another person crash and burn, they don't want that to happen, so they may tend to come in sooner.
Yes.
Certainly families that tend to be proactive tend to maybe come in sooner. Some maybe, I don't think anybody could come in too soon, but sometimes they come in sooner. But don't forget, Vera, the active addict does a very good job, and it's not because they're a scam artist, don't get me wrong. The addict's, alcoholic's brain is invested in continuing to drink and use. So the survival center of the brain, as you would say, continues to want that drink or drug. And so any kind of so it's the brain's job is to get rid of any kind of hurdle or obstacle that's going to get in the way of the person having that drink.
Makes the person become very cunning and crafty and lie.
That's it.
Yeah.
And they may not lie about other things, but they'll lie about that.
And anger is a way of controlling and keeping those obstacles, which could be family members, away. And also there are families that really, they just don't know what the resources are for them. And that keeps them away.
We have another caller. Louise, you're on the line for our guests, Hamish or Donna.
Hi, good evening. Thank you for taking my call. My question is about if a parent suspects a child is using drugs or alcohol in a problematic way, how can a parent help their child? So help them recognize that they have an issue perhaps, or just getting the help they need to get the support they need.
Let me just ask you before I pass that on, how old is the child that you're thinking? Are we talking about a young adult or a teenager? Or?
A teenager.
Yeah, okay. One of you like to take the call?
Very often it is parents that are identifying the drug use as problematic, likely have talked to the young person about it, identified it as a problem, and heard from the young person that it's not. So sometimes the parent is the catalyst for change. Most people that are calling us are family members. So it really is almost an intervention that parents create by coming in and getting some counseling.
Is it a good idea in those circumstances for the parent to say, if you don't stop, you'll have to leave?
I think that, we don't need to always go after a fly with a machete when a fly swatter will do.
Right.
So, there are ways of parents assisting kids to come in and speak to a counselor, acknowledging that they may not know a lot about drugs and alcohol, but they would like their child to come in and at least speak to someone who can let them know whether that's a problem.
So if the parent is beginning to sniff out that there's a problem, what would your approach be?
Get help sooner than later. Speak to somebody sooner than later.
So parent should do that, or parent should tell child to do that?
Parents should get the information they need in order to support their child getting help.
So, Louise, do you want to ask something further, or does that answer your question?
No, that's helpful. Thank you so much.
Oh, thank you very much for calling in. And if there's anybody else out there who wants to call in for a question, we're here to answer your questions or brainstorm. You're not alone. Okay.
So
Yep.
in terms of working with an adolescent or a teenager,
Yeah.
so they know everything.
Yes.
I just need you to know that. They know
Right.
everything.
And everything's fine.
Everything's
cool.
fine, and whatever they've discovered with their peers or friends is sort of sacrosanct, and the adolescent brain is much more vulnerable to the effects of alcohol and drugs than an adult's. You know, a 25-year-old takes much less anesthetic. If a 15-year-old and a 25-year-old are on the operating table, takes less anesthetic to put out the teenager because their central nervous system, I've been told, isn't developed, so they're more vulnerable to the effects of drugs.
And also to just addiction itself.
Exactly.
Yeah.
It's 15% of the population seems to develop a problem, but if they start using as a teenager, it goes up to 25%. It takes 7 months to do the same kind of damage as it takes an adult 7 years.
Wow.
So it's very fast. Fast.
Boy, you've really captured that.
So what ends up happening is parents don't understand what's happened. Suddenly, from a malleable school attending, tutor, after school activity involved young person is suddenly saying, you know what, I'm not doing that anymore. I don't have to do it. You're not the boss of me, and leave me alone.
I bet you there would be a knee-jerk reaction to say, let's just yank that kid out of that environment and stick them in one of those survival camp 6-month, year-long things. Do you get people asking those kinds of questions?
Well, I think certainly we have parents moving, neighborhoods moving schools in an effort to, outrun the drugs, and certainly, treatment programs are wonderful for individuals who need them and would benefit from them. But certainly we want to start with what's ever least intrusive, and help that individual recognize the impact drugs are having in their life.
Yeah, so sometimes what happens is the parents may say, you're a drug addict, you need to get help, and they go, well, it does not connect with the child because the child does not feel that at all. And so when they come to see Donna, Donna counsels them and talks to them and gives them ways to kind of approach the young person and maybe make it more likely they're going to come in.
So there's dialogue that's started.
Absolutely, absolutely.
Yeah.
You may be right. You may, for example, you may be right. There isn't a problem. Maybe we're overreacting, but we're worried. So go and prove it to us, and go in and
which is a much nicer way to, what could be a very taut, tense environment.
Well, it's respectful and loving, and that's what parents really want to be for their children.
So we have another caller. Gary, would you like to give us your question, please?
Hi.
Hi, Gary.
How are you? I appreciate being able to speak. I'm not sure whether it's more of a question or general observation. Unfortunately, I have a son who is now 18, who has been through, as a teenager, been through several addiction centers. He's been diagnosed with concurrent disorders. And my general observation is that generally in Ontario, there's just a lack of good treatment centers, or particularly places that are especially able to treat concurrent disorders. That's mental health issues together with addiction. And it's very frustrating because the better known centers such as Hinks, treatment centers, Youthdale, are mental health oriented. CAMH. My son was at Pine River, which is a well-known concurrent disorder center, and it's very frustrating because you get so far and you think he's done so much, and boom, there's a relapse, and it's a difficult role to play as a parent because you have to always constantly balance between tough love and understanding that relapse is
Yeah.
a sort of expected course of recovery as well.
Okay.
It's unfortunately that I've seen in our system that mental health funding or even for addiction funding seems to fall to the bottom of the barrel, and it's unfortunate.
Okay.
I
Gary,
don't know if anybody wants to comment about any of this.
Yeah, thanks a lot, Gary. I'm going to cut you off because I want Hamish and Donna to have an answer, and we have another caller after that, so just to be aware. But please, you want to give I'm sure you've dealt with this issue where there's kids are coming in with more than one.
I think the majority of the young people we see have some underlying issues, be it depression, anxiety, or other mental health
Probably
diagnoses.
attention deficit or...
Absolutely. And it is frustrating in terms of resources. I know what we try to do is create a team with other professionals in the community so that if somebody is working with a mental health professional, psychiatrist, we will endeavor, to work with them so that we're on the same page.
Well, presumably, you have a psychologist on staff as well, so
We do
you
have
are
a
addressing
psychologist,
that.
yes.
Hamish, did you want to add something to that?
Well, I agree that there's a paucity of services here in Ontario and long waiting lists, and certainly for a teenager over 16, they have to want to go. That's another piece. I mean, I'm not advocating. But anyway, people need to be put into treatment against their will. But I think that often what happens when somebody is a young person is using, they're not thinking straight, and sometimes parents need to have to act in order to get them into a center where they'll have to stay for a while in order to get better.
Right.
There are such centers, some in Alberta, some in the States, and usually often what happens when a parent or when a child ends there, that they're initially very upset. But years later, they look back and they thank their parents very much. So to speak to the caller, there isn't anything like that here in Ontario, although I would like to believe it's getting better. I think there's more funding. There's more funding for the concurrent. When I first started doing this, Vera, it was the addiction. I mean, I worked at the Clark Institute, and there was the ARF, and the guy would come in and he'd be crazy, and they'd go, no, he's high. And then I would take him, because that was my job, over to the ARF, and they'd say, no, he's psychotic, and we'd go back and forth all night. That's not the case anymore.
No, I think just in general, psychiatry is recognizing that. That's also a new phenomenon. It's being illustrated by the slower but gradually progressive treatments that are responding.
So I guess to speak to the caller, that that I think it's very important. Sounds like he knows this, that in order to get his own support, and to work, he's not alone. That there are other families going through the same thing.
Good. So Gary, thank you very much for your call. That really inspired some good thoughts. Callers, if you have any, if this has inspired you to want to call in, please do. And we have another caller, Ali. Would you like to give us your question?
Yes, thank you very much for giving me opportunity.
Hi, Ali.
Hi. Alcohol and drug abuse is the main issue we are facing today here in Toronto. And we see the result of it these days, a lot of shootings going on in a city. And my question is, I am a frontline worker, and I have seen many people who have mental health issues, and alcohol and drug addiction is on the street. So how we can empower communities, a community, instead of empowering government agencies, such as Toronto Public Health, or PHAD, why we don't empower community agencies so they can take a lead on the issue rather than, this is my question. Thank you very much.
Thank you, Ali. I mean, it seems to me that the thing that comes to mind for me right away is, well, we can empower the family. That's the essence of community, isn't it? Anyway, would you like to pick up on that?
I think it does begin with families getting the support they need, getting a larger voice, a bigger voice, and advocating for some of the needs that that they're recognizing, and whether it's lack of services, lack of education, but I think it can start with families.
Are we relying too much on the family, or are we Yeah.
Well, I think that as a profession, we want to support these families, and we want to support them in their concerns about resources and access to services and identifying services that they can go to for help. So I don't think it's a matter of us relying on them. I think we need to find ways of supporting these families.
Yeah, actually, I think that leads to the next question I was going to ask you, which is what kind of support is there for families? You've already a little bit touched on what you offer. Do you want to elaborate on what you offer, and then also what else is out there?
Well, we do, as I said, work from a family-centered approach, so we do meet with families. We offer support groups for them, individual work with families and couples, or individual work with spouses, again, to support and empower families to pay attention to their own recovery and how they can support their loved one. But there's also community supports for families, and maybe you can speak to some of those.
Well, I think that to speak of community, there is a one of the other things that was in that article was with the Rod Ford debacle, and and as the caller, as Ali says, there's there's a lot of stuff going on out there, that there actually is a very solid recovery community. There's Alcoholics Anonymous, there's Narcotics Anonymous for the actual and others, but there's also Adult Children's of Alcoholics, so that supports people that have grown up in an alcoholic home and they're adults. There's Nar-Anon, which is the family's aspect of Narcotics Anonymous. There's Al-Anon, and certainly
Al-Anon,
yeah, sure.
Yeah.
And certainly, coming up soon in this March, there's an Ontario regional conference where the Al-Anons get together and the AAs get together, and there's the real feeling of community.
So what is it about those communities, like Al-Anon, for example? What is it about that makes it so helpful? I mean, our previous caller said that she was a member of Al-Anon, and that helped her learn the dance. So can you give a little bit of information for those people who don't know anything about it?
About? Al-Anon. Sure. Well, Al-Anon is the sort of sister program of Alcoholics Anonymous, and it's designed for wives initially, but now it's for any family member.
And it can be a mom or even a friend.
Absolutely, yes. Anybody, sure. There is a program, a 12-step program that's involved. But I think initially what it offers is a place where people are no longer alone. And certainly the alcoholic's family, the alcoholic's wife, the alcoholic's husband, the alcoholic's father, mother, whatever, often feel there is no help and there's nobody who understands. And by going to one of these support groups, they go, I am not alone anymore.
So do people actually go to these groups?
Oh, yes.
Yeah?
There's Al-Anon all over the world.
Yeah.
And I think, the beauty of Al-Anon, just like AA, it's kept simple. There are steps that one follows and understands that leads to their own recovery. And it does build a sense of community when there are other people who speak the same language you're speaking.
Yeah, and have the same experience that you're having and whatnot. Yeah. So Ali, thank you very much for your call. And again, I invite speakers, or callers rather, to call in and ask some questions, or even just share your experience, something that worked for you when you got help. So Al-Anon, people come to it. It's been helpful for people. It's something that you would recommend, obviously.
Yeah,
Yes.
I think that our recommendation is people go give it a try. It's absolutely free. I think the suggestion is you go to 6 or 8 meetings. I'm not sure whether it's 6 or 8, but let's call it 8. I like 8.
Yeah.
And we don't give up after 1 or 2. And if at the end of 8 meetings it hasn't been the least bit helpful, then don't go back.
Right.
And if it turns out that it has been helpful, then you've ventured, nothing is lost.
And that's a sort of very non-professional approach.
Yes.
What about professional approaches? What else is out there for people?
There are various parent support groups in the private sector. Some parents have formed their own mutual support groups over years. I think it really is important.
How would you hook into that?
Well, I think that, I think that resourcing is sometimes a bit of a detective story for people, but they can certainly go on websites and research support for families of
you can just
addicts.
type it in.
And you will find, different recovery programs that offer groups.
Okay. Now, Hamish, I remember you mentioning to me once that there's actually recovery programs that a person can go to, a treatment center, or like Hazelton has a family program where people go just to that. What's your thoughts about that?
Well, I think any good treatment center has a family program. And, so why do I say that? I had one of my first clients, who was a female, had gone, she'd actually went to Hazelton, and it really helped her. And she came back and she was very grateful. And she said to me, treatment centers are like maternity wards. I went, really? Maternity wards? She goes, yeah, you go to a maternity leave ward and you have a baby, but you don't leave the baby back in the hospital. You come home with the baby, and that's when the work starts. And so really the family program in a treatment center helps the entire family learn how to change the diaper, so to speak.
Right.
So there is, now they range from a 4-day, 5-day kind of program, which is more informational. Like this is sort of what we're talking about, like what to do, what not to do, and that it's a disease and we should learn about it.
So it would be like a crash course of what you do in the community.
Yes.
Okay.
And then there's other ones that are much more intense. Edgewood out in Nanaimo has one of the best family programs, I believe, in Canada. Karen Foundation has a couple of family restructuring programs that Donna's actually gone and visited, where the whole family goes to treatment, Vera, for 2 weeks.
Including the addict.
The addicts in their treatment and the families in their living, they're in there in treatment because they need that extra help to get it together.
To learn how to behave differently so that they don't enable versus love.
There are also programs, Westover, which is here in Ontario, as well as Betty Ford, have programs for family members, whether their loved one is in treatment or not. It really is focused on their recovery, so those are opportunities as well.
And I believe Renaissance has a family program that is modeled after the Betty Ford program, and that's here, right here in Toronto.
That's right, yeah. And they have a children's program too, specifically.
Exactly.
Yeah, yeah.
And there are family structured recovery counselors. I've done some training with Deborah J. and Jeff J. through Betty Ford. And it's an opportunity for families while their treatment is going on to do their own recovery work. And at some point, their recovering loved one joins that process, and they become together the recovery team.
Now, what if, God forbid, something happens, the family's doing all this work, that the addict is doing their work, and it doesn't work? They just keep relapsing, they just keep messing up. What do you do then? That must be very frustrating.
It definitely is frustrating for families, and what they learn is that while relapse is very, very difficult on everybody, including the addict, that there are tools that both the family and the addict have to work back into recovery. We
have another question. David, you're on the line now. We've got a couple of minutes. Why don't you ask your question, and then I might have to cut you off, but maybe not, and we'll see where it goes. So why don't you start with us, just give your question.
Okay, first of all, excuse my voice, I have a bit of a cold.
It's all good.
A couple prong questions. What is there any link between drug use or alcoholism and prior sexual abuse?
And sexual abuse?
Yeah, prior sexual abuse. Yeah.
Oh, okay.
And I've been married for 20 years, and all of a sudden, I'm experiencing some issues with my wife. Is this deep? I'm concerned.
Well, I think it goes back to what Hamish said earlier about people using for what they feel are good reasons, and people do sometimes find themselves self-medicating to avoid painful issues in their life. So when there's trauma in somebody's life, that may be a coping skill that they've evolved.
Right, yeah, I mean, in terms of the abusing the drugs themselves, yeah. I mean, it's definitely true that sexual abuse, or even any kind of trauma, just like you said, for sure. Hamish, did you want to add something to that before we...
Well, I think I like what Donna said. Not everybody who is sexually abused goes on to use drugs, but it certainly is a vulnerability, because guess what? It helps people feel better. It's a medicator. It works better than anything else until it doesn't. It works for a little while, and then it doesn't.
Was there another? I think you had a part 2 to that question. Can you ask that again?
Yeah. How realistic is it to have 3 kids and somebody going to rehab, or like a day rehab, or a full rehab, or private or public rehab?
You mean so who's going to take care of the kids? Is that your question?
Well, yeah, we have 3 kids, and what are our options?
So there's the practicalities for sure. Do you want to grab something you can there? We only got about 10 seconds or so, but do you want to start with that and we'll come back?
Just really briefly, I hear that a lot. I haven't got time. There's no possible way I can get away.
Yeah.
I guess to work with a counselor on an outpatient basis, say, well, what can I do? Because I have to do something. To do nothing is going to make things worse.
David, I'm going to ask you to hold the line. We're going to come back because Hamish still has more to say about this. So we will be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. Today we're discussing and taking your questions on addiction as a family disease. So just before break we were talking with David, and he was asking, I guess, what sounded like some practical questions about, I know I've got to go to treatment, or somebody in the family does. What do we do with the family who takes, what are some of the practical issues? And I think, Hamish, you were just, I had to cut you off.
Was that your question, David? How practical is it, or what can I do? What exactly is your question?
Well, the practicality. You have 3 children at home, and if somebody has to go into rehab or something, how do you, what do you say to kids, or how do you approach this whole thing? Or?
Well, it's excellent, first of all, that you're looking for a solution, and it's definitely, there's definitely some practicalities that need to be sorted out. I don't want to give any kind of generic advice, except to say that if you would like to call us or call Donna tomorrow at the office, she'd be more than happy to help you with specific details about what can happen. Just to say that this, I hear this a lot, that I can't possibly get away. I can't possibly go. There's too much going on, and there is always something. There's always something going on. And so what I say to people is to take a look at what is going to happen if you don't get the help. Like, let's play this out for a few more days, weeks, years. What's going to happen? Well, the chances are that things are going to be a lot worse. Whereas if there's a short-term or even medium treatment put in place now, then down the road things are going to be a lot better. But that's not something that you or most people know how to do, and that's why there's professionals. Certainly Donna's willing to help. There's, I don't have it with me right now, but there's the 800 DART line that people can call, and that's a resource.
What kinds of things would you suggest? So, let's say mom wants to get treatment and she's got 3 kids, or she's got even 1 child, and what does she do?
I think I can only answer generally that we would take a look at what resources are available in the family that might be able to support somebody going to treatment, or we would look for programs perhaps that are intensive outpatient programs, or one-to-one counseling in groups, something that would get the process started.
Yes, okay. Well, I think actually, for example, Renaissance, person would go, what mother would go to the family program and the child would go to the children's
Depending on
program.
the age of the
Yeah,
children.
yeah, that's right, that's right. We have another caller. Shelley's on the line. Shelley, would you like to give us your question?
Yes, I would. Thank you. I've been listening to the program and tapped in a little bit. Noting, Hamish, you were talking about the different organizations that are outside in out west and perhaps a few, but not very many in Ontario. And as me, being a single mom, I have a young adolescent male who has struggled with some alcohol addiction, and finances are an issue. Trying to find the right place to treat him as a cohesive, dealing with the trauma. Lost my husband when he was a young boy, patching through here and there, can't find a great place that can take it all on and pick up the tab, unfortunately. Is there any direction you could give me?
Well, there are actually, for the son, there are actually a couple of programs that do take, like they're funded by the Ministry of Health, so that is actually for the addict or the alcoholic. There's a bit of a wait list, but it's not that terribly long. Like Renaissance, it's about 3 months or something like that, and other places, I think it's a bit longer, 6 months or longer. But what about the family? There's Al-Anon, of course.
There's Al-Anon, but also some of the programs have family groups as well. There are some groups in the community, and again, if somebody wants to call, we can talk a little bit more about that depending on where they live, and we can talk about what resources are funded by the ministry and what realistically the wait lists are like, and whether it's a good fit, depending on what's happening. Are you saying that you
can do that, or
I can certainly help somebody do that. The other place to call, Sunnybrook Hospital has Family Navigation Project that helps families link up with resources.
Okay.
I really do empathize with this caller. It's very difficult if you don't have a lot of money and you're looking for some resources, sooner rather than later. Often the wait lists are very long, or by the time you get in, then you're told you don't fit.
Yes.
And that's we hear this a lot.
Yes.
That's why we try to sort of step up to the plate as quickly as possible and meet the services. But unfortunately, we're not publicly funded.
Yes. So, Shelley, was that helpful, or is there a further piece you want to ask?
No, that is helpful. You're absolutely right. You're caught between a rock and a hard place because he needs that go-away treatment and wants to go. Can't afford it.
Yes, yes. Well, Shelley, thank you so much for calling in. So can you, just to sort of sum up that question, if you can just as a sort of summary, give us what some of the places are and what websites, if you know of any on hand.
Again, there's Family Navigation that is out of Sunnybrook Hospital.
Sorry, Family
Navigation Project.
Yes.
Out of Sunnybrook Hospitals, and they help families identify resources.
Okay, and that's free because it's part of the hospital.
That's free.
Okay. And there's
there are.
And there's an 800 number called the Dartline Drug and Alcohol Registry of Treatment.
Okay.
That I don't have it with me. I should have brought it, but
yes.
You call it, and they're open probably till about 11 o'clock every night.
Okay.
And they will direct you to the closest and
yes.
most appropriate ministry-funded
service. And what about some of the 12-step ones that are for free?
Sure. So. Just AA.org, Al-Anon.org, Families Anonymous. They're all in there.
Al-Anon, Alateen.
Alateen, and they are totally free of charge.
Yes.
And they're there. And in Toronto, there's meetings with these fellowships probably every night of the week.
Okay. And if they wanted to get a hold of you, that would be
sure. And if anybody who's listening, if they have a question. Just want to ask one or two things, feel free to call us, either Donna or myself. We're more than willing to take the call, or someone else on the team. Should I put the number out, or?
Put out the number.
So our phone number is 416-640-1061, And ask for Donna or Hamish, and we'll be glad to help you with any questions that you may have.
Well, I want to thank you both for your willingness to come out and speak about this issue. Family. Well, we are out of time. I'd like to thank our guests, Hamish White and Donna Alexander. And I'd like to thank all of our callers. We'll be back next month with more Toronto Speaks Addiction. Thanks for watching.